Good morning. My name is Michelle Spencer. I'm the Associate Director of the Bloomberg American Health Initiative, and I am pleased to be joined this morning by Dr. David Carlisle, Charles Ardrey University of Medicine and Science, and President James Hildreth from Meharry Medical College. This morning, we'll be talking about reducing health disparities by advancing equity. And I have just a few questions for our panelists. We know that data is at the core for advancing evidence-based public health. How can we leverage data disaggregated by race and ethnicity to ensure access to health disparities and access to health is equitable?
So thank you, Michelle, for being a part of this important conversation. The first thing is we have to collect the data on these different minoritized groups and make sure that those data are used to distribute the resources we have available to us. The problem right now is that we're not collecting disaggregated data for many of these minoritized groups in our country. We have to do that first and make sure that gets done and hold accountable those organizations responsible for doing so. But we cannot have effective healthcare policies or public health policies without the data. It's as simple as that.
Thank you for that. Dr. Carlisle, we use data to develop policies to advance the work. Dr. Hildreth just mentioned that we have to collect the data. Share your thoughts on the importance of collecting data, particularly in minority communities.
Well, for years, decades, even generations, we've had anecdotal knowledge of healthcare disparities. You talk to a person on the street and they would say, yes, the healthcare system discriminates against me. But it wasn't until we started collecting data that we actually could measure and quantify healthcare disparities. And once they could be quantified, indisputably, we were able to start taking action because people couldn't ignore the presence of healthcare disparities. The data made those disparities no longer anecdotal. They made them something that policymakers couldn't help but focus on. And that just shows the importance of collecting data.
Can you talk a little bit about advancing health equity? We know that it requires a multi-system reform approach, but what would you consider to be the most important first step to facilitate change?
Well, I would say one word: commitment. We need to sustain our commitment to driving forward to eliminate healthcare disparities. We've made great strides recently because we have been committed, and we need to sustain and maintain that commitment to continue to move forward because disparities still exist, gaps still exist, and opportunities to improve our healthcare system still exist.
So Dr. Hildreth, we just heard from Dr. Carlisle this commitment, right? But who is this commitment from? There's multi-systems that are involved in this. Who would you say this commitment is required of and coming from?
Well, it has to be required of the governmental agencies and that are involved in delivering healthcare and public health. The large systems in our country, both academic and private and public, need to be committed to this. Without the commitment across all those organizations, this is simply just not going to happen because all of them have an impact on the health of the populations that we're talking about. So the commitment is widespread and has to be uniform across the board.
Thank you for that. I wonder if you would comment, Dr. Hildreth. We know that COVID-19 exposed health disparities that have been present for hundreds of years. Mm-hmm. How can we optimize this moment to really move beyond conversation and really make impactful policy change to directly address some of these gaps?
I think it comes down to accountability. We have to hold those accountable who can impact the health of the populations in question. That means large healthcare organizations, even the agencies responsible for this. We have to hold them accountable. And the accountability must have some consequences for failure to achieve the goals we have. So I think accountability is key to this.
So we heard the importance of collecting data. We heard commitment, and we've heard accountability. Dr. Carlisle, what would you say as a final thought?
Well, I'd say one more thing. We need to make sure that our healthcare workforce is not only accountable to the populations that it takes care of, but represents and includes those populations. That's how we make big change in our healthcare system.
Thank you both for joining me this morning.
Thank you.
Thank you.